To me, this is a very holistic treatment almost, because really what are we doing? We're removing the bacteria that's causing the problem and then letting the body's own systems take over to reconnect the gum back to the tooth and restore health.
So no more bleeding gums in this case?
No more bleeding
breath?
gums, no more bad breath. And the beauty of it is it happens so quickly. It's not weeks and weeks of visits. It's not multiple visits. It's a couple visits and people are treated.
Well, logically, it definitely makes sense. And I'm not trying to side with you too much. You know, on this. And people need to know that, you know, this is a real interview. Nobody's reading scripts. We didn't rehearse this. But it seems like that if anybody has this problem, they should go in and get it done by a laser. Period. I mean, is that your thoughts?
Well, that was the conclusion I came to as well, and that's why I got involved with the laser.
So, as of today's day, you're the only periodontist in Long Island that has one of these lasers.
That's right, and it's really been a revolution to my practice for a few reasons. First, I've always tried very hard not to do periodontal surgery, because for myself, I wouldn't want it if I needed it. So we would do scaling. Anything non-surgical that seemed like it worked, I would investigate and try to use to the extent possible. And I think over the years, patients really appreciated coming to my practice because I wasn't very quick to take out the scalpel and to do gum surgery. But the flip side is that if you don't treat gum disease sufficiently, it's not enough. Some people would say, well, I don't want the surgery, I just want scaling. Just scale my teeth and don't do anything else. And you would...
Do they tell you that?
Some people would, and you have to respect them. That's what they're choosing. But they would have a false sense of security because they were treating their disease insufficiently. And if you treat it insufficiently, ultimately it's going to fail. They're going to lose their teeth anyway. So to me, the beauty of the laser is that they could have their cake and eat it too. We could treat it, we can get rid of the pockets, we can regrow some of the bone they've lost around the teeth without them having to go through surgery and all that that entails. And I think people really appreciate that. And the proof is in the pudding, because so many patients come from other patients who've been treated this way. Everybody talks, and I see the results every day, both in terms of patients coming back after treatment saying, wow, that was a breeze, I'm so glad that I did this.
So pain is not something they complain about, really?
They don't. In fact, I've had a number of patients, Randy, who had conventional periodontal surgery years ago. They broke down again, they needed periodontal treatment again. So these people are the perfect controlled experiment. They've had conventional cut and stitch periodontal surgery, and they've had laser treatment. And without exception, they say, that laser was a breeze, I would never do that other kind of surgery again. This was simple, and it is simple. You're anesthetized, you sit, you have it done, and afterwards there's really very little downtime.
So how soon before they see results after the treatment?
The results are almost immediate. People come back a week later and already they're saying, boy, my gums don't bleed anymore, my mouth feels great, and the effect on their body is immediate as well. I'm going to tell you two fast stories.
Okay.
As a lot of people probably know, gum disease affects diabetes. So people who are diabetic, number one, are more at risk for severe gum disease. And diabetics who have severe gum disease, their need for insulin or diabetic medications is higher, because gum disease is a chronic infection, and chronic infections drives up someone's blood sugar. I had a patient a few months ago who was on an insulin pump, and he had tremendous periodontal disease, hadn't been to the dentist in 20 years. I treated his dad, and his dad referred him to my practice, and he used to have to put a new vial of insulin in his insulin pump every 3 days. We did his laser treatment, and he was in last week for a quick check, and I said, just out of curiosity, are you using less insulin? He says, you know, a vial of insulin lasts me 5 days now. Think about how his overall health has improved because he's treated his periodontal disease. It's really fantastic. And the other thing we see sometimes is, you know, when people have tremendous gum disease, you know, it's a chronic inflammation in the body.
So it is a chronic infection? You called it an infection. Is that what it is?
You know, when people think of infection, they think of, you know, a big abscess or something, a toothache type thing. It's really a chronic inflammation, and the body is constantly mounting this immune response to try and get rid of the bacteria, but it can't get rid of the bacteria. So if you ever had the flu, you know that when you're sick, your body's fighting this massive war against what's invading your body. You have no energy at all.
Good point.
So many people who have severe gum disease, after their disease is treated and their body doesn't have to constantly fight this infection, they just feel like they have more energy.
Wow.
I've never read
makes sense.
I've never read a study on it, but I've had so many people tell me, I just feel better, I have more energy. And you know, sometimes I think some of that is also because of how they feel about themselves. They don't have the worry. Most people who have this problem worry about it, worry about what's going to happen if they don't treat it.
Wow.
So that's constantly on their mind. Their breath is always on their mind. It's like that worry is just cleared off their plate and they can go on with things. They can smile, they can eat, not bleed. They don't feel bad every day when they brush their teeth and they spit into the sink and they see blood. And I think part of their feeling better and having more energy, aside from the biologic part, is just the psychological part of, boy, that's done. I don't have to worry about that anymore. I'm going to keep my teeth. I'm going to have a nice smile. I don't have to have dentures in the nursing home. I don't have to limit what I eat. I don't have to be embarrassed kissing my favorite person I like to kiss. They just feel good again.
What about cost comparison between the cutting and stitching and this laser?
You know, that's the beauty of it too, Randy, is that with conventional treatment, you have a number of visits with the hygienist, a lot of surgical visits. It's very time consuming. It's a lot of hours of that patient
So
being
it can
in the
be
office.
more.
It can be more. Most times, traditional cut and stitch surgery is more expensive than using the laser. You would think this is such a high-tech thing, and it's so much, so fewer side effects, so much faster. It should cost more, but many times it costs less, and it becomes a win-win.
So when do people, by the way, at what age ranges do people start getting this problem? And when should they do something about it?
That's a great question. You know, many people have gingivitis throughout their life, just the inflammation of the gum, and at a certain point it starts to become bone loss. For some people it's in their 20s, for some people it's in their 30s, for some people it's in their 40s. But a lot of times when it's early on, people ignore it. They say, the dentist will say, well, you have early gum disease, or it's just starting. So what does that do? It sort of minimizes it in the person's mind.
So you're in your 30s and your gums are bleeding.
You're in your 30s, your
Last
gums
thing
are
you're
bleeding.
Gonna do is go to the dentist, I guess.
Right, you think I have a mortgage, I have young kids, I have all this stuff. The last thing I want to do is have, you know, gum surgery.
So talk to them then. What do they need to know? Those
some-
30-year-olds that have these problems.
You can save a whole lot of problems down the road by treating your gum disease early on. If you have bleeding gums, if you have pockets, treat it and resolve it at a younger age. It'll be
So zap it out. Just zap out that bacteria.
zap it out.
Laser it out.
Laser it out. Treat the gum disease early on, and you'll enjoy your teeth, enjoy fresh breath, enjoy strong teeth, enjoy the vitality that comes with having your teeth, hopefully for the rest of your life.
Okay, good. Well, I want to thank you for coming on. And by the way, if somebody wants, their first move is what? They call your office, make an appointment. How long before they know they're a candidate?
That's a great question. You know, a lot of people just want information on this technology. And for people that just want information, call our office. We can mail you a booklet. We can mail you all sorts of information. Number two, we have a very thorough website just discussing laser periodontal therapy. So you can go to the website and read about it there. If you want to come into the office, there's two ways you can come in. Some people just want to talk. They don't want a whole exam. They just want to have some questions answered, and we have what's called a meet and greet. Call our office, say, I'd like to have a meet and greet with Dr. Scharf.
Is that right? Good for you.
And, you know, we just schedule 5-10 minutes, say hello, show them the office, show them the laser, show them what it's all about. And then if they want to become patients, we can schedule regular appointments. And some people just know they want us to treat their gum disease. They call up and say, I'd like to make a new patient exam. So you call up, we schedule you either for a new patient exam or a meet and greet, and take care of your problem.
All right. Well, thank you for coming on the show. Very, very interesting.
Thanks for having me.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, or if you have a friend that has these symptoms, these gum disease symptoms, and you want them to see the interview, we'll have it on our website at wellnesshour.com. For now, I wish you good health.